we're trying to build a system that learns as quickly as it possibly can. And an effective learning system largely has got to be good at two things. It's got to get data out of experience and turn that into learning, but then it's got to make sure it acts on what it has learned. The simple idea is that we have to take insights and opportunities for learning that arise on the patient care floor and make sure we can capture those and elevate them to a level in the organisation where we can aggregate them, where we can make sense of them, where we can consider their meaning and understand to what extent should this learning cause us to change what we are currently doing. We need to learn a lot about the operations of building and running a 4,000-bed intensive care unit, not something anybody's done before. And we have to learn a lot about how to mobilize that workforce and keep them safe, both physically and, most importantly, psychologically, because it's an intensely stressful environment that we're asking people to work in. So those ideas and their suggestions for improvement that come from the shop floor, the observations of what's working and not working well, they come to what's in the middle there as our quality and learning group. We needed one entity that was going to make sense of all of that. And from that, suggestions for change. Those changes are put into action in a number of ways. We change protocols and standard operating procedures. We have daily briefings for each shift going into the contaminated zone and debriefing of the shift coming out of the contaminated zone. So some of the changes are going to be expecting to be very rapid. Some are going to require validation and simulation, and some of them are going to require formal quantitative research. So we've tried to meld those three things all coming into the same place.